Hi everyone, this is our second video blog of a journey with my husband who is 50-year-old, and he just went in at 7:19 for a TLIF. It's about 9:20, so we're 2 hours in. The doctors said that it'll be about a 4-hour procedures with the imaging and the cut time and getting everything done. But anyway, I wanted to share with you the pre-operative experience that I had and my husband had. So we got here at 5:30 this morning. There's just a few people here. They brought us into the waiting room and registration at 6. We did all that, and then we went to the pre-op room about 6:10. Excuse me. And they checked the band that the registration put on my husband, make sure that it's the right patient, right date of birth, everything. The MRN numbers match the chart, which is very good because we want to make sure that it's the right patient and we're not doing anything that is not supposed to be done. So that was, reassuring to me, and I'm sure to Curtis. The nurse came in to the room. It was clean. It's disinfected. There was a gown, red socks, and CHG wipes on the bed for us to start getting ready. Before we did that, she did all the checklists. She had a physical chart and she checked off different things as she asked questions and we answered. So that was very reassuring. I like that part. Then we took the CHG wipes to help kill the bacteria. We did one for the torso. We did another one for both arms. We did another one for his back. And we did one of them for the right leg front and back and one of them for the left leg front and back. So there's 5 total wipes that you're gonna get in a package, and they're pretty warm, so it's not cold. It's not like a cold bath. And then once you get that done, you put on your hospital gown. And of course, for the wipes, you have to take your clothes off, everything off. You're gonna be hanging in the wind, sorry. But anyway, after we did all the wipes, we put on the gown and Curtis got into the bed that was clean. It was disinfected and everything. One thing that I really liked during that part for the CHG bath is that they had a diagram on the wall where they had blue. All the areas that you're supposed to get are in blue, and all the areas that you're supposed to not get were in gray. So your head and your peri area and your bottom, because you don't want that stuff in your mucous membranes because it can cause damage. So don't do your face and don't do your crotch or your butt. So, and it had like one wipe for the torso, one wipe for this arm, one wipe for this arm. So it kind of just walked you through it. So that was really cool. I'll have to go back and take a picture and use that for my own practice as an RN. But anyway, so we waited for, I think, about 30 minutes. She got the IV started. She started the normal saline, which is standard fluid. It's like a whole liter or 1,000 mLs that they start you on pre-op. And that usually takes like 9 hours to go in. So it's not going to be like a, like a bolus, we call it. And it's not going to go in over an hour. It's going to go in very slow. And then she started vancomycin and ceftriaxone. Vancomycin is just kind of like a broad spectrum antibiotic that catches everything. And ceftriaxone, same thing. Actually, vancomycin is very sensitive to MRSA. That's one of the ones that kills off MRSA. And MRSA is a big thing, but they give it to you sometimes just in case. You might be colonized with it, not in the hospital, but it's just like a just in case thing that they give you vancomycin. And it also just kills off a lot of bugs. So for that, the reasoning for all that is just to prevent infection, because you don't want an infection on your back. So they're very diligent about prevention on that. So the CHG wipes and your antibiotics will prevent infection, along with everything that they do in surgery. They keep everything sterile. They scrub up sterile. They have sterile gloves on. They're sure not to touch anything or retouch anything. If they touch anything outside the sterile field, they're supposed to change everything. So they're like, it's very strict in the hospital when it comes to sterile procedure, they call it. The instruments are still everything. I'm not an OR nurse, so I can't speak to that. But I'm a med-surg ortho tele nurse, and I've been doing it for 13 years. And so these are just some of the things that I share with patients and have educated them on. But after that, we waited for about 30 minutes for the anesthesiologist to come in. He came in, took the actual physical chart, and he flipped through, and he signed off, or he checked off everything as we were answering the questions that he was asking, and I really appreciated that. He also made sure that he was talking to the right patient by asking your first and last name and date of birth, and he was very good at answering questions and giving us the anesthesia plan, what he's going to be using and all that. One of the things that was interesting that I didn't know that they do, but it makes sense because it's the back that they're working on with my husband, is that they actually have like little monitors that monitor like your neurons during the thing. I don't know how that happens. Like, I've never heard of that because I'm not in that world, but that was really cool. And he said that they also put like little electrodes that can like press into your skull a little bit. So afterwards, if you have like a little bleeding in your skull, that's what that's from. But during the surgery, they actually, I guess, check, from my perspective, I guess it would be like the dermatomes. Each section of your body has like certain nerves that go through it. And it just, I guess it would monitor, you know, how those nerves are doing. But again, anyway, that was just interesting. That was just interesting to me. From what I remember of him explaining, that's what it was about. And then after they left, signed off on everything, Dr. Smith came in, explained the procedure, made sure it was the right patient that he was talking to with the right date of birth, and the right MRN or medical record number. And then he talked to Curtis. He told him the risk and benefits, what he's going to be doing. And then he signed the consent that the nurse provided to him. And they made sure that everything on the consent matched what Dr. Smith said that he would do. Then they marked the site. And then they left again. It was like maybe 5 minutes more. And then the CRNA, the anesthesia nurse, she's certified in anesthesiology, so she's like a lower level from an anesthesiologist. Anesthesiologist is like a medical doctor level, and then you have nurse practitioners that are like nurse level anesthesiologists, which is actually the top of the nursing field. That's like the highest degree that you can get and the highest profession. So it's excuse me, pretty cool. But so she came back in. She gave Curtis something for, I think, anxiety, just to kind of, you know, start calming him down. But before she came in, Curtis was getting very anxious. He's been anxious the last few days, which I can understand because it's his back, and a lot of stuff this can affect a lot of stuff if it's not done right. But we both have total confidence in the team. It's just natural, you know, because you don't know what to expect. And that plays into it, definitely. We prayed together, and that helped. And it was just hard as a wife, because I didn't know what to tell him. I wanted him to believe that it's all going to be okay, and he just, you know, be calm. Because that's what I want. I don't want to see him anxious. But I get it, you know, and it doesn't make me think of him any less of a man, because he's been a trooper. He's always taken care of his family. He's been in good spirits this last year and a half. I can't imagine how he's been doing that, because I'm actually pissier than him most days. So, and I don't have anything wrong. But anyway, that's my own sanctification opportunity. And with the help of Jesus and the Holy Spirit, I'll get better. I won't do it on my own, but he does convict me of it. So it's just the natural man coming out on that issue. Anyway, off subject. But as far as me mentally right now, I mean, it's 2.5 hours into his surgery. He's supposed to be in there for 4 hours, just 2 hours for cut time again, for Dr. Smith to do his thing. And then they're going to do imaging to make sure everything is in place before they take him back to PACU. So if there's anything that's off, they're able to fix it right then. And again, he got what he went in for was a minimally invasive robotic guided TLIF. So Dr. Smith's going to do part of it, and then I think the robotic, and I guess they do it through like a little tube. It's like very small tubes that they do all this through. It's just really cool. Curtis can actually speak to that later on because he remembers more of it than I do. But anyway, as far as my mental state, I'm okay. I've been calm. I did get teared up a little bit before they actually took him, because I think that's when it hit me a little bit, you know. Sorry. Because everything is in their hands, you know, and like I'm very grateful that we have 250 years of medical experience that leads up to all this, and all the people and all the families that might have had to suffer so my husband could get something almost very safe, like, you know, like we don't really have to worry about much anymore. Any side effects or anything going wrong are very rare nowadays. But still, you know, it's like it's not set in stone, and that's where faith comes in, and trusting in God that whatever happens will be for my good. And that's part of the experience, is in growing and maturing, is going through these things. So and like I get it. I'm not bitter. I get it. It's part of the Christian walk, and I know there's a lot worse that could be happening. But anyway, so as a wife, I tried to do the best that I could. I prayed with Curtis. You know, I said, well, at least you'll be able to mobilize around. You can't live like this. And you'll kind of know what to expect for the next surgery, you know, if you ever have a surgery again. Because he did have a Newson fundoplication for reflex, but that was when he was like 17, so a little younger. And not your back. Anyway, and I don't know. I'm not going to go into that because I'm going to start babbling again. But yeah, so we'll see how it goes. I'm going to go back in and see where Curtis is on the updated board. I've just been here in the parking lot doing this vlog, making sure that it's as comprehensive as possible and understandable as possible. So this is like my third take, but thank you guys for listening. I hope it does help you. This has helped me process everything. And I hope it really does help you, because I know, like, when we were searching through YouTube, it was hard to find some of this information. So, and then just trying to provide you a little bit of a clue about why they do what they do from a nurse's perspective, as I've been practicing for 13 years. So I hope it eases some fears, it answers some questions, and we'll see you on the next vlog. I'm gonna try and get post-op. We'll see what happens. Probably just a short little thing to see how Curtis is doing and what recovery looks like sometimes. All right, thank you. Have a great rest of your morning.